If you're over 60 and your legs feel heavy, cold, weak, or painful when you walk, the problem may not be your age. It may be your blood flow quietly failing to keep up. And when blood flow gets weaker, your legs do not always scream for help. Sometimes they whisper first. A calf cramp on the stairs. Feet that feel colder than the rest of your body. A small sore on the toe that takes too long to heal. If senior health warnings like this help you stay independent, subscribe now, because the first sign is one many people mistake for just getting older. Warning sign number 1, the walking pain that disappears when you rest. The first thing weak blood flow often does is show up during movement. You may be walking through a store, climbing a few steps, or going from the parking lot to the front door. At first, everything feels normal. Then your calf starts aching, tightening, or cramping. You stop for a minute and the pain eases. That pattern matters. Your leg muscles need more oxygen when you walk. Healthy arteries can increase the supply. But when the arteries are narrowed, the muscles ask for more blood and the body cannot deliver enough. That is why the pain often appears during walking and improves with rest. Many seniors explain this away as weak knees, old muscles, or lack of exercise. And sometimes those things are involved. But the pattern is the clue: pain with activity, relief with rest, then pain again when you start moving. This does not mean every leg cramp is dangerous. But if the same walking distance keeps triggering pain, your legs may be telling you that blood flow is not matching demand. The important question is not, am I getting old? The better question is, why do my legs fail at the same point every time? Warning sign number 2, heavy legs that make short trips feel longer. Weak blood flow can also make your legs feel heavy, tired, or slow, even before sharp pain appears. This is the kind of symptom people rarely mention at first. They just start changing their life around it. They park closer. They avoid longer aisles. They sit down more often. They stop taking walks because the walk feels harder than it should. That is how independence shrinks quietly. When blood flow is weaker, the muscles may not get enough oxygen during activity. The legs can feel drained faster. You may feel like you are dragging them instead of using them. The tricky part is that heavy legs can come from many causes: low fitness, nerve problems, medications, heart issues, anemia, joint pain, or circulation problems. But after 60, a new pattern deserves attention, especially if it keeps getting worse. Here is the simple way to think about it. Tired legs after a long day are common. Legs that become heavy after the same short walk again and again are a message. And the next sign is even easier to dismiss, because it can happen while you are doing nothing at all. Warning sign number 3, cold feet, one foot colder than the other. Cold feet can sound harmless. Many people joke about it. They wear thicker socks and move on. But when blood flow to the legs is weak, the lower leg or foot may feel colder, especially compared with the other side. That comparison matters. If both feet are a little cold in winter, that may be ordinary. If one foot is often colder, paler, or different in color, that deserves more attention. Blood carries warmth. When less blood reaches the foot, the skin can feel cooler. The toes may look pale, bluish, or darker than usual. The foot may feel strange in bed, as if it never fully warms up. This is where many seniors make a mistake. They treat the coldness only as a comfort problem. More socks, hot water, a heating pad. But if the real issue is reduced circulation, heat on the outside does not fix the supply problem on the inside. And using too much heat can be risky if feeling in the feet is reduced, especially for people with diabetes or nerve damage. So notice the pattern. Is one foot colder? Is the color changing? Is there numbness, pain, or a sore that is not healing? Those details tell a better story than my feet are cold. Warning sign number 4, numbness, tingling, or weakness that changes your balance. Weak blood flow can affect how your legs feel, but nerves can also be part of the picture. Some seniors notice tingling in the feet. Others feel numbness, burning, pins and needles, or a strange weakness in the lower legs. The dangerous part is not only discomfort. The dangerous part is balance. If your feet do not clearly feel the floor, your brain gets less information with every step. That can make you less steady when you stand from a chair, turn in the bathroom, or walk in a dark hallway at night. Poor circulation is not the only cause of numbness. Diabetes-related nerve damage is a common reason for tingling, burning, or loss of feeling in the feet. Spine problems can also send symptoms down the legs. Certain vitamin problems or medications may play a role too. But the practical lesson is the same. Do not ignore changing sensation in the feet. A small loss of feeling can change how you walk. A changed walk can increase the chance of stumbling. And after 60, one fall can change everything. This is why leg symptoms are not just about legs. They are about freedom. Getting to the bathroom safely. Walking outside without fear. Standing up without holding the furniture. The next sign moves from feeling to appearance, and it is one of the most overlooked clues. Warning sign number 5. Shiny skin, slow toenails, or hair loss on the legs. Your legs can show circulation problems on the surface. If blood flow stays weak over time, the skin on the legs may look shiny or tight. Hair on the lower legs may grow more slowly or disappear. Toenails may grow slowly or become thicker. The skin color may look different from before. Most people do not connect these changes with blood flow. They think that's just aging skin. And yes, skin changes with age. But circulation also feeds the skin, hair, and nails. Think of it like a garden hose. If the water pressure is low, the farthest part of the garden suffers first. In the body, the feet and toes are far from the heart. When supply is reduced, the small signs often appear there. This is why a quick look at your feet matters. Not in a fearful way. In a protective way. Look for changes that are new, one-sided, or slowly getting worse. A leg that looks much smoother than before. A foot that changes color. Nails that stop growing normally. Skin that looks fragile. These signs do not diagnose the problem by themselves. But they are worth bringing to a clinician, especially if they come with walking pain, coldness, numbness, or slow healing sores. And that brings us to the sign you should never brush off. Warning sign number 6, a sore on the toe, foot, or leg that will not heal. This is where weak blood flow becomes more serious. A tiny cut on the toe, a blister from a shoe, a small scrape on the lower leg. For a younger person with strong circulation, it may heal quickly. But when blood flow is poor, the body has a harder time bringing oxygen, nutrients, and healing cells to the area. So the sore stays open. It scabs, then opens again. It becomes painful. Or worse, it does not hurt much because feeling in the foot is reduced. That last part is important. If you have diabetes or numbness in your feet, you may not feel an injury clearly. You may only notice it when you take off your sock. A sore that does not heal is not something to wait out for weeks. It needs medical attention, especially if there is redness, drainage, worsening pain, dark skin, fever, or a bad smell. This is one of those moments where caution is not fear. It is protection. Healthy legs do not just move you. They repair themselves. When repair slows down, the body is asking for help. The next warning sign is different because it can wake you up at night. Warning sign number 7, leg or foot pain while resting. Earlier, we talked about pain that appears during walking and improves with rest. But if circulation becomes more limited, pain can sometimes appear even when you are resting or lying down. Some people notice foot pain at night. They hang the leg over the side of the bed because it feels better lower down. That can happen because gravity helps bring more blood toward the foot. This is not a small clue. Pain at rest can mean the leg is struggling even without activity. It does not mean you should panic, but it does mean you should not treat it like ordinary tiredness. Ask yourself, is the pain in the foot or toes? Does it wake you? Does changing position help? Is the foot cold, pale, discolored, or weak? Is there also a sore? Those details matter. And if pain is sudden, severe, one-sided, or comes with a cold, pale foot, sudden weakness, chest pain, shortness of breath, or confusion, do not wait. Get urgent medical help. Most circulation problems build slowly, but some problems need immediate attention. Warning sign number 8. One swollen, warm, painful leg. Not every blood flow problem is about narrowed arteries. Sometimes the danger is a clot in a vein. This can look different. Instead of coldness, you may notice swelling. Instead of pain that comes with walking and eases with rest, you may have tenderness, warmth, redness, or discoloration in one leg, often in the calf or thigh. This matters because a deep vein clot can be serious. If part of the clot travels to the lungs, it can become life-threatening. So here is the simple rule. One swollen, painful, warm leg should not be ignored. And if that comes with shortness of breath, chest pain, coughing blood, fainting, or a racing heartbeat, seek emergency help. This is why leg symptoms after 60 should never be treated as one simple category. Arteries, veins, nerves, muscles, joints, and the heart can all change how the legs feel. The goal is not to diagnose yourself. The goal is to notice the pattern early enough to ask the right question. What to do if your legs are showing these signs? Start with patterns. Write down when the symptom happens. Does it appear after walking 1 block? After stairs? At night? In one leg or both? Does it improve with rest? Is there coldness, numbness, color change, swelling, or a sore? This kind of note helps your doctor much more than saying, "My legs feel weak." Also pay attention to your risk factors. Weak blood flow in the legs is more common with age, smoking, diabetes, high blood pressure, high cholesterol, and a history of heart or blood vessel disease. Do not stop medications on your own. If you think a medicine is connected to dizziness, weakness, swelling, or leg symptoms, bring the pattern to your doctor or pharmacist. And ask directly, could this be a circulation problem? Sometimes that one question changes the visit. Doctors may check pulses in your feet, examine the skin, compare both legs, review your risk factors, or order tests. One common circulation test compares blood pressure in the ankle and arm. At home, the safest first step is awareness. Look at your feet. Notice walking distance. Protect your skin. Wear shoes that do not rub. Keep diabetes, blood pressure, and cholesterol managed with your care team. If you smoke, getting help to stop is one of the strongest circulation steps you can take. Movement can help many people, but the right kind and amount depends on your situation. If walking causes leg pain, do not simply force through it without medical advice. The goal is safer strength, not proving toughness. After 60, weak blood flow can change your legs in quiet ways. It can make walking painful. It can make your calves feel heavy. It can make one foot colder. It can change skin, nails, and healing. It can affect balance, confidence, and the way you move through your own home. But the most important point is this: leg weakness is not always just age. Sometimes it is a signal. And when you catch the signal early, you have more choices. More time. More control. So the next time your legs feel different, do not only ask, "How do I push through this?" Ask, "What is my body trying to tell me?" Because strong legs are not only about muscle. They are about blood flow, nerves, balance, healing, and independence. And independence is not a small thing. After 60, it is everything.